But you guys did awesome. So can this replace insurance? I'll start with Nick here.
So what we say at our office is that direct primary care is a solution for primary care. Now, primary care is probably 85 to 90% of what everyone needs in a year, but we're not a replacement for insurance because I can't cover, from a financial perspective, your cancer, major surgery, major hospitalizations, those kind of things. What we can change the price point for and cover is primary care, which is chronic disease management, preventative care, well visits, stitches, routine labs, medications, imaging tests, counseling, a lot of those kind of things. And in that sense, we replace a lot of those things that are used by insurance but used inappropriately. So you're not going to the gas station and filling up your car with gas and swiping your insurance card. That would be silly and would make your car insurance super expensive. So instead, we use direct primary care and pay cash for those things, but you still need something for catastrophic events. And so we say that you still need insurance. Now, if patients don't have insurance or are uninsured, we still help them and care for them in the best way possible. And really for those times when you do need to use your insurance, that's really when you need somebody on your side to be your advocate and be able to help you navigate the healthcare system. And that's where a direct primary care doctor can really shine.
I like to answer this question by saying that direct primary care can help people to use their insurance in a cost-effective manner. And especially with more and more Americans now having high deductible plans where they're paying the first, sometimes several $1,000s out of pocket, direct primary care really provides a way for those patients to control their costs and to have someone with their direct primary care physician, someone who can help them navigate the rest of the system in a cost-effective manner. And I think if patients are asking me about what insurance to choose, I mean, I tell them I'm not an insurance agent, but generally a high deductible plan, like the highest deductible that you feel like you can afford for your family, is going to give you the most cost-effective plan, because as long as you can cover that deductible if you need to, you're going to be paying a whole lot less in premiums, and you're still going to be having great access to primary care through your direct primary care practice.
I really don't have too much more to
I
add
know,
to
you
all of
probably
that.
don't, because they did such a good job. Anything you got?
I've got much better answers than that. It's,
I knew he would.
no, I'm teasing. A statistic that we all throw around, 70% of the care for 70% of the years of your life are all done in primary care. But that still leaves some very, very expensive things. Cancer, surgery, hospitalization typically is kind of the three things I throw out there to patients that they understand. You need insurance. The problem is in our country, we want to use our health insurance a lot because we pay so much money for it. And I understand that thought process, but the reason we pay so much money for it is because we use it a lot. If we used every other form of insurance we have, our home insurance, our car insurance, if we use them a lot for tires and spark plugs and gas, I always love the analogy, our car insurance would be astronomical. So we buy car insurance, we buy homeowners insurance, we don't ever want to use them. I have life insurance. I don't want to use it.
But what about your wife? What about your wife? Does she?
As long as I'm more valuable alive than dead. So it's not worth much, the life insurance.
So it's an actuarial matter.
Right.
Really.
But that's the thing is, I tell my patients all the time, stop using your health insurance for the little stuff. It's costing you money.
So yeah, the good answers on those guys.